Our top story now, a second minister, Dara Singh Chauhan, has quit Yogi Adityanath's cabinet in Uttar Pradesh after Swami Prasad Maurya's shock resignation the day before. He's the second OBC leader to quit Team Yogi just before next month's state elections, and his reasons for doing so echoed Maurya's explanation. However, while Akhilesh Yadav has been all too quick to tweet photographs of himself with leaders exiting from the BJP, the netas in the limelight are playing it cool. Interesting, a court in Sultanpur also issued an arrest warrant against Swami Prasad Maurya in a case over a hate speech that he allegedly made in 2014.
First Swami Prasad Maurya and now a resignation by UP government minister Dara Singh Chauhan. The reasons offered mirroring those of Maurya, the alleged neglect of backward classes by the government. Once again, a tweet from Akhilesh Yadav welcoming Mr. Chauhan.
जैसे जैसे चुनाव करीब आएगा और हर फेसेस के चुनाव हैं, बहुत जल्दी नॉमिनेशन से पहले लगातार नाम आएंगे. जब पिछली बार स्वामी साहब मौर्य जी साथ आए, हमें खुशी है, उनके साथ और साथी भी आए हैं. समाजवादी पार्टी की जो आने वाले समय में लड़ाई है उसको और आसान किया.
But like Swami Prasad Maurya, Chauhan says he will decide later.
जो हमारे शुभचिंतक, जो हमारे समर्थक साथी हैं, जिनके सहयोग से मुझे कई बार लोकसभा से लेकर विधानसभा तक पहुंचने का मौका मिला है, उनसे मैं बुलाऊंगा, राय करूंगा, जैसा उनका निर्णय होगा. इतनी पूर्ण बहुमत की आपने देखा कि सरकार बनी और सरकार बनने के बाद उनको न्याय और इंसाफ नहीं मिल पाया.
Chauhan is an OBC leader from Eastern UP. He was a long-term Bahujan Samaj Party leader before joining the BJP in 2015. When he joined, he was made the president of the BJP's OBC Morcha, and in 2017, he became the Minister for Environment and Forests. Sources in the BJP claimed that Dara Singh Chauhan was unpopular in his area and was going to be dropped anyway. But two big ministers and 4 MLAs exiting the BJP in a space of 24 hours is bad news for the party. 24 hours after he resigned from Yogi Adityanath's cabinet, an arrest warrant against Swami Prasad Maurya from a court in Sultanpur in an ongoing case over a hate speech he allegedly made in 2014. But Maurya remained unfazed and was still cryptic about joining Akhilesh Yadav's Samajwadi party.
मेरे इस्तीफे का स्वागत कोई करेगा, मैं उसको धन्यवाद दूंगा. हमारे इस्तीफे का कोई भी स्वागत करेगा, हम उससे धन्यवाद देंगे. हजारों कार्यकर्ता आ रहे हैं, मैं सबको धन्यवाद दे रहा हूं.
समाजवादी पार्टी नहीं ज्वाइन कर रहे हैं अभी.
14 जनवरी को वो भी तय हो जाएगा. हम क्या कर रहे हैं?
तो 2 दिन क्या करेंगे आज कल?
2 दिन हम अपने साथियों से, कार्यकर्ताओं से जो हजारों की तादाद में कल से लगातार आ रहे हैं, मैं उनसे मिल रहा हूँ, सुन रहा हूँ, उनकी बात को सुन रहा हूँ, उनकी भावनाओं को समझ रहा हूँ.
Maurya may be non-committal about joining the SP, but many from the party visited him in Lucknow today, including this ex-MLA from Eastern UP.
ऐसा कोई विधानसभा नहीं है जहां कि 2000 से लेके 5000, 10,000 वोट न बढ़े. हर विधानसभा में इनका 10-5,000 वोट बढ़ने का काम होगा.
A question which everybody is asking whether more BJP lawmakers will quit and align themselves with Swami Prasad or with Akhilesh's Samajwadi party.
One of the ministers about whom rumors are circulating, Dara Singh Chauhan, issued this video today.
मैं भारतीय जनता पार्टी में हूं और भारतीय जनता पार्टी में ही रहूंगा. मैं आपके माध्यम से खंडन करता हूं कि मैं पार्टी नहीं छोड़ रहा हूं.
The deputy chief minister once again tweeting an appeal for a dialogue, but the BJP's local unit in Kushinagar, from where Maurya is MLA, burst crackers over the exit and called it good riddance.
जनता हम लोगों को कोस रही थी कि आपके विधायक, आपके मंत्री क्षेत्र में नहीं रहते हैं. हम लोग भी घुटन महसूस कर रहे थे और उसकी क्षतिपूर्ति करने के लिए हम लोग जनता का सहयोग कर रहे थे. उनके जाने से भारतीय जनता पार्टी पर कोई असर नहीं पड़ेगा और पडरौना की सीट भारतीय जनता पार्टी बड़े अंतरों से जीतेगी.
There is speculation more ministers could quit and join Maurya and Chauhan soon. With Uday Singh, Saurabh Shukla and Vineet Verma, this is Alok Pandey, NDTV.
But it's not just the BJP that's lost leaders in Uttar Pradesh. Congress MLA Naresh Saini and Samajwadi Party MLA Hariom Yadav, both from UP, have joined the BJP. Both Saini and Yadav hail from backward castes, and the BJP's decision to induct them into its fold appears to be aimed at refuting suggestions that it's confronting challenges in maintaining its strength among the OBCs. So the BJP, facing a rebellion in the ranks with the exit of 6 leaders over the last 2 days, is considering fielding Yogi Adityanath from Ayodhya and the assembly polls, according to sources. While the BJP core group has discussed this possibility, Prime Minister Narendra Modi is yet to sign off on the proposal, which could happen at an election committee meeting later this week. An earlier suggestion was that Yogi contests from Mathura, but now it seems increasingly more likely that it could be Ayodhya, where the ongoing construction of the Ram temple has boosted the BJP's profile. The temple town is also situated in the Awadh region, where the Samajwadi party has been traditionally strong. Well, let's focus on the COVID situation in the country, and Prime Minister Narendra Modi is expected to interact with chief ministers today over the prevailing COVID situation amid a surge in infections due to the Omicron variant. He will be interacting with the chief ministers at 4:30 today via video conferencing. That's what sources have said. The Prime Minister had chaired a high-level meeting last week to assess the COVID situation in the country, ongoing preparedness of the healthcare system, and the status of the vaccination campaign. Now, with India's COVID positivity rate at 11.05%, the centre said the rise in positivity rate in the last 12 days have been sharp and concerning. On December 30th, the case positivity rate was 1.1%. Niti Aayog member Dr. V.K. Paul said Omicron has fast replaced Delta and warned that Omicron is not a common cold. In fact, a rise in deaths has also been observed in the last 2 weeks in 24 states by an average of 56%. 973 deaths have been reported, excluding Kerala, and states with most cases this week. 5 states have had 2/3 of India's cases: Maharashtra, West Bengal, Delhi, Tamil Nadu, Karnataka. And states with the fastest rise in cases have been Uttar Pradesh, Bihar, Puducherry, Tripura and Madhya Pradesh.
India is seeing a surge in COVID across the country. Kolkata's positivity rate is a staggering 60%, Mumbai's at 27%, and Delhi and Chennai at 23%.
You can see rapidly rising test positivity rates, phenomenally high, 25%, 30%, even 60%.
The immediate worry are the election campaign in 5 states. Rallies are banned till Saturday, but there are still small gatherings where masks and social distancing are largely missing. COVID trends in poll-bound states are a major cause of concern. Major cities in all 5 states seeing positivity rate of 5% and more. UP's weekly cases are rising at over 1300%. UP's reproduction number at 3.5, the highest versus India's 1.4. Less than 1% indicates spread of cases. 16 of 22 Punjab districts have positivity rate above 5%. Weekly positivity rate in all of Goa is over 23%. However, the centre today refused to say whether the ban on election rallies will be extended. Just that they are sharing data with the Election Commission.
जैसी सिचुएशन इवॉल्व होती है वह इलेक्शन कमीशन के साथ साझा भी की जाती है. जब भी वह मांगते हैं उसके बेसिस पर कोई भी डिसीजन होगा लिया जाएगा.
Top officials have urged the public to take Omicron seriously and warned that it can badly hit healthcare systems.
Omicron is not common cold. इसी ओमिक्रॉन की वजह से कई देशों के हेल्थ सिस्टम कोलैप्स हो गए. इसी की वजह से बहुत हद तक हेल्थ वर्कर्स को घर में छुट्टी लेके बैठना पड़ा और प्रेशर पड़ा.
During assembly elections in 5 states last year, stricter curbs to contain the spread of COVID-19 were brought in by the Election Commission of India. And while similar curbs are expected this time as well in the poll-bound states amid a rising third wave of COVID-19 in the country, more important will be to see that whether these curbs are implemented on the ground and respected by the political parties as well. With camera person Ashok Mahalia, Mukshidongde for NDTV.
Director General of the ICMR, Balram Bhargav, stressed on 7-day home quarantine for all contacts of any positive case according to the guidelines, and he added that they should continue to wear a mask.
Most important is home quarantine for all contacts for 7 days. So if I have come here for work, I go back home and I test positive, all my relatives who are above 60 or comorbidities should be tested. All my children, etc. should not be tested but have to be in home quarantine for 7 days, have to be in home quarantine for 7 days as per guidelines, and continue to wear masks. So use of mask is vitally important when you are doing home quarantine.
Now, Delhi logged 27,561 fresh COVID cases, which is a 29% rise over cases in the last 24 hours and the most number of cases in a day since April. The positivity rate has touched 26%, which is the highest in 7 months. On April 20th last year, the city reported 28,395 cases. The city also reported 40 COVID deaths, which is the most since June 10th, when it reported 44 deaths. Active COVID cases, according to the health bulletin, stand at 87,445, which is the highest in the last 8 months. Now, Maharashtra reported 46,723 new cases. That's a 36% rise. 32 new deaths were reported in the state. The state reported 34,424 cases and 22 deaths the day before. If we talk about Mumbai recorded 16,420 new cases, a 40% rise in a day. The positivity rate is up to 24.38% from 18.75% in just a single day. And the sharp rise came after 4 days of decline in daily cases. Of the 16,420 new cases, 83% are asymptomatic, according to the BMC.
We have increased our line from 10 lines to 30 lines now. Even the war room doctor staff has been increased. Even the area of the war room has been increased.
The BMC COVID ward war rooms are a critical piece of infrastructure in tackling the third wave of COVID, largely believed to be driven by the Omicron variant. Now, in this wave, most patients are in home isolation, and that means that the ward war rooms are keeping track of their treatment.
ओके, का केली होती? काय सिम्पटम्स होते मॅडम तुम्हाला? हातपाय अंग दुखत होतं आणि थोडीशी कसकस होती. तुम्हाला बीपी डायबिटीज काही आहे का? नाही. ॲस्मा थायरॉइड आहे? हो. आता तसं काही त्रास नाही होत, म्हणजे नॉर्मल आहे. वॅक्सिन घेतलं मॅडम किती?
So you can see how every detail of the patient who is in home isolation is being collected here by this lady from the ward war room of the BMC.
ठीक आहे मॅडम, बाकी काही असेल ना तर या नंबरवर कॉल करा. ठीक आहे, हा इमर्जन्सी लँडलाईन नंबर आहे. काही त्रास झाला तर या नंबरवर कॉल करा. ठीक आहे, थँक्यू सो मच.
The patients say they feel assured by the calls.
माझं वय 70 वर्ष आहे. 4 दिवसापूर्वी कोरोनाचे मी पॉझिटिव्ह आले. शेकडून वारंवार चौकशी केली जाते, फोन करून औषधं दिली जातात. परत आमचा BP, ऑक्सिजन लेवल हे सर्व कसं आहे हे सर्व चौकशी केली जाते. म्हणजे आमची काळजी घेतली जाते BMCकडून.
Ankur Gupta, a bank employee, says the ward war room has been following up regularly with him.
BMC has been really proactive in making sure that, you know, I am not left alone in such tough times. I got multiple calls from various people in BMC asking if I needed anything, if I needed any help.
Here's another call that's taking place at the same time. Let's just listen into this conversation as well.
अच्छा, अगर आपके घर में फैसिलिटीज अवेलेबल है तो आपको होम क्वारंटाइन कर देंगे. ओके, ठीक है, चलेगा. थैंक यू सो मच सर.
Last 2 to 3 days we are receiving near about 400 to 500 ka list, but before that 2 to 3 days before we were receiving the list of 1,900 patients.
This is how the ward war rooms in Mumbai are tackling the third wave of COVID. With camera person Rajendra Dhalkar, inside the ward war room of the G North ward, Saurabh Gupta, NDTV.
Now, with big harvest festivals due in states, there are fears of them becoming super spreader events. Already, COVID curbs have been relaxed in Assam despite soaring positivity for the Bihu festival, and the Bengal Chief Minister's decision to allow the Ganga Sagar festival to go ahead has also raised eyebrows. Andhra Pradesh too has postponed night curfew ahead of Makar Sankranti. Now, these decisions may prove to be popular in the short run, but at what cost?
Assam is gearing up for its biggest harvest festival, Bogali Bihu, at a time when there is a major COVID spike with 2,800 cases reported yesterday. Yet, the state government has lifted curbs to allow celebrations but not large gatherings.
We are mostly in touch with the various organizers of functions and all. Since no express restrictions have been put as of now, we are still monitoring the situations.
Curfew hours would be relaxed for a day to allow people to celebrate Bihu, even though experts say a large community gathering might cause a big surge in places like Guwahati, where the positivity rate is above 10%.
Replication level is much higher than the other variant. That is why we must be very concerned and we must be very cautious.
At a time when Assam is witnessing a major spike in the number of COVID cases, with the positivity rate in Guwahati more than 10%, people are also gearing up to celebrate Assam's biggest festival, the Bhogali Bihu.
In Bengal too, which is badly hit by the current surge, the authorities have allowed visitors and holy men from many states at the Ganga Sagar Mela. Chief Minister Mamata Banerjee has allowed public events, even though provisions have been made for RT-PCR tests and also vaccinations at the venue, even though vaccination's efficacy kicks in only after 2 weeks. At Sikandrabad railway station, a rush to catch trains headed to Andhra Pradesh, as people go home to native towns and villages for 4 days of Sankranti celebrations.
अरे तो जाना तो है ही है ना, जाना एक सत्य है, आप परहेज रखिए, कोरोना के मास्क लगाइए, सैनिटाइजर लगाइए,
భయం ఉంటుంది బట్ మన జాగ్రత్తలో మనం ఉంటే బెటర్ అండి. ఫేస్ మాస్క్ వేసుకొని శానిటైజర్ ధరించుకొని వెళ్ళడంలో బెటర్.
So the Andhra Pradesh government that had initially imposed night curfew from Tuesday, the 11th of January, postponed it by 1 week from January 18th to 31st. It also said no more than 200 people at public events and ceremonies and no more than 100 people in indoor events, whereas cockfights like this one are very popular and are usually witnessed by several hundreds. Experts worry that the celebrations may take the COVID numbers from the urban cities to the villages, where this harvest festival is largely celebrated. With Ratnadeep Chaudhary in Guwahati, Shankar in Kolkata and Nagaraju in Hyderabad, Uma Sudhir for NDTV.
Welcome back. Let's focus on Kerala now. In 12,742 cases were reported on Tuesday. Kerala crossed the 10,000 mark after 3 months. 23 deaths have been reported, though 176 deaths were added through appeals. Kerala has seen a 100% rise in daily COVID cases in the last week, and even so, the CPM organized a cultural performance.
In Kerala's rural Thiruvananthapuram, the ruling CPIM's Parshala Area Committee organized a massive cultural performance on Tuesday with over 500 participants, a run-up to the party's district conference. Organizers claim social distancing was maintained, but visuals tell another story about COVID protocols.
The latest COVID restrictions by the ruling left government in Kerala does not ban for political, social, cultural gatherings to be held physically, but rather recommends for it to be held online unless important. And as cases of COVID surge in Kerala as well as the capital, it's important to relook what's important and what's not.
The daily COVID cases in state capital Thiruvananthapuram have hit a 4-month high as positivity rate crosses 22%. Across Kerala, the growth rate in daily COVID cases increased by 100% last week compared to the previous. For some on the ground, it's business as usual. For others, business has dried up.
The
Kerala Health Minister insists the spike is still driven by the Delta wave impact currently in the state.
ഈ ആഴ്ചത്തെ കേസസ് നമ്മൾ പൊതുവെ നോക്കുമ്പോൾ 20 മുതൽ 40 വയസ്സ് വരെ ഉള്ളവരിലാണ് കൂടുതലായിട്ട് കേസുകൾ കാണുന്നത്. അതിന്റെ അർത്ഥം അത് പൊതു ഇടങ്ങളിലുള്ള സമ്പർക്കം മൂലവും ധാരാളമായി പുറത്തേക്ക് നമുക്കറിയാം ക്രിസ്മസ് ന്യൂ ഇയർ കാലമായിരുന്നു. അപ്പോൾ ആ രീതിയിൽ സമ്പർക്കം വഴി കൂടുതലായി കേസുകൾ ഉണ്ടായിരിക്കുകയാണ്. ഈ ഒരു ഏജ് ഗ്രൂപ്പിലാണ് കൂടുതലായിട്ട് കോവിഡ് കേസസ്.
With camera person SP Babu, Sneha Koshi for NDTV.
Welcome back. News from Jammu and Kashmir, and one policeman was killed, 3 army soldiers injured during an encounter with terrorists in the Kulgam district. One terrorist has been killed and 2 civilians were also injured in this encounter. Let's go across to Nazir for more. Nazir, what's the latest?
Well, Gargi, this operation is underway since yesterday evening, but the security have suffered casualty in this. One policeman has lost his life in action. A fallen soldier is Rohit Chib. He is a local policeman and he has been killed in this encounter. And 3 army soldiers have been injured. 2 civilians have also been injured in this encounter. And according to police, 1 Jaish-e-Mohammed militant has been killed in this encounter. It was started last evening in Kulgam district. The security force launched a joint operation at a place called Parivan in Kulgam district. In the ensuing encounter, 1 policeman was killed in the initial shootout and 3 army soldiers were killed. Eventually, 1 of the militants was killed. And according to police, the operation is underway, but since morning there is no update whether there has been any more militants and also what is the condition of those who have been injured.
Hello and welcome. You're watching Good Morning India. I'm Gargi Rawat. Let's focus on UP first. And a second minister, Dara Singh Chauhan, has quit Yogi Adityanath's cabinet after Swami Prasad Maurya's shock resignation. He's the second OBC leader to quit Team Yogi just before next month's state elections. And his reasons for doing so echoed Maurya's explanation offered less than 24 hours ago. However, while Akhilesh Yadav has been all too quick to tweet photographs of himself with leaders exiting from the BJP, the netas in the limelight are playing it cool. Interestingly, a court in Sultanpur also issued an arrest warrant against Swami Prasad Maurya in a case over a hate speech that he allegedly made in 2014.
First Swami Prasad Maurya and now a resignation by UP government minister Dara Singh Chauhan. The reasons offered mirroring those of Maurya, the alleged neglect of backward classes by the government. Once again a tweet from Akhilesh Yadav welcoming Mr. Chauhan.
जैसे जैसे चुनाव करीब आएगा और हर फेसेस के चुनाव हैं, बहुत जल्दी नॉमिनेशन से पहले लगातार नाम आएंगे. जब पिछली बार स्वामी साहब मौर्य जी साथ आए, हमें खुशी है, उनके साथ और साथी भी आए हैं. समाजवादी पार्टी की जो आने वाले समय में लड़ाई है उसको और आसान किया.
But like Swami Prasad Maurya, Chauhan says he will decide later.
जो हमारे शुभचिंतक, जो हमारे समर्थक साथी हैं, जिनके सहयोग से मुझे कई बार लोकसभा से लेकर विधानसभा तक पहुंचने का मौका मिला है, उनसे मैं बुलाऊंगा, राय करूंगा, जैसा उनका निर्णय होगा. इतनी पूर्ण बहुमत की आपने देखा कि सरकार बनी और सरकार बनने के बाद उनको न्याय और इंसाफ नहीं मिल पाया.
Chauhan is an OBC leader from Eastern UP. He was a long-term Bahujan Samaj Party leader before joining the BJP in 2015. When he joined, he was made the president of the BJP's OBC Morcha, and in 2017, he became the Minister for Environment and Forests. Sources in the BJP claimed that Dara Singh Chauhan was unpopular in his area and was going to be dropped anyway. But 2 big ministers and 4 MLAs exiting the BJP in a space of 24 hours is bad news for the party. 24 hours after he resigned from Yogi Adityanath's cabinet, an arrest warrant against Swami Prasad Maurya from a court in Sultanpur in an ongoing case over a hate speech he allegedly made in 2014. But Maurya remained unfazed and was still cryptic about joining Akhilesh Yadav's Samajwadi party.
मेरे इस्तीफे का स्वागत कोई करेगा, मैं उसको धन्यवाद दूंगा. हमारे इस्तीफे का कोई भी स्वागत करेगा, हम उससे धन्यवाद देंगे. हजारों कार्यकर्ता रहे, मैं सबको धन्यवाद दे रहा हूँ.
समाजवादी पार्टी नहीं ज्वाइन कर रहे हैं अभी.
14 जनवरी को वो भी तय हो जाएगा. हम क्या कर रहे हैं?
तो 2 दिन क्या करेंगे आज कल?
2 दिन हम अपने साथियों से, कार्यकर्ताओं से जो हजारों की तादाद में कल से लगातार आ रहे हैं, मैं उनसे मिल रहा हूँ, सुन रहा हूँ, उनकी बात को सुन रहा हूँ, उनकी भावनाओं को समझ रहा हूँ.
Maurya may be non-committal about joining the SP, but many from the party visited him in Lucknow today, including this ex-MLA from Eastern UP.
ऐसा कोई विधानसभा नहीं है जहाँ की 2000 से लेके 5000, 10,000 वोट न बढ़े. हर विधानसभा में इनका 10-5,000 वोट बढ़ने का काम होगा.
A question which everybody is asking whether more BJP lawmakers will quit and align themselves with Swami Prasad or with Akhilesh's Samajwadi Party.
One of the ministers about whom rumors are circulating, Dara Singh Chauhan, issued this video today.
मैं भारतीय जनता पार्टी में हूं और भारतीय जनता पार्टी में ही रहूंगा. मैं आपके माध्यम से खंडन करता हूं कि मैं पार्टी नहीं छोड़ रहा हूं।
The Deputy Chief Minister once again tweeting an appeal for a dialogue, but the BJP's local unit in Kushinagar, from where Maurya is MLA, burst crackers over the exit and called it good riddance.
जनता हम लोगों को कोस रही थी कि आपके विधायक, आपके मंत्री क्षेत्र में नहीं रहते हैं। हम लोग भी घुटन महसूस कर रहे थे और उसकी क्षतिपूर्ति करने के लिए हम लोग जनता का सहयोग कर रहे थे। उनके जाने से भारतीय जनता पार्टी को कोई असर नहीं पड़ेगा और पडरौना की सीट भारतीय जनता पार्टी बड़े अंतरों से जीतेगी।
There is speculation more ministers could quit and join Maurya and Chauhan soon. With Uday Singh, Saurabh Shukla and Vineet Verma, this is Alok Pandey, NDTV.
But it's not just BJP MLAs who are leaving the party. Some are joining as well. And Congress MLA Naresh Saini and Samajwadi Party MLA Hariom Yadav, both from UP, joined the BJP yesterday. Both Saini and Yadav are from backward castes, and the BJP's decision to induct them into its fold appears to be aimed at refuting suggestions that it's confronting challenges in maintaining its strength among the OBCs. So switching of parties happening before elections. Now, the BJP facing a rebellion in the ranks with the exit of 6 leaders over the last 2 days in UP is also considering fielding Yogi Adityanath from Ayodhya in the assembly polls. While the BJP core group has discussed this possibility, the Prime Minister is yet to sign off on the proposal, which could happen at an election committee meeting later this week. An earlier suggestion was that Yogi contest from Mathura, but now it seems increasingly more likely that it could be Ayodhya, with the ongoing construction of the Ram temple has boosted the BJP's profile. The temple town is also situated in the Awadh region, where the Samajwadi Party has been traditionally strong. Well, on to COVID news now, and Prime Minister Narendra Modi is expected to is meeting with chief ministers today over the prevailing COVID situation in the country. Amid the surge in infections due to the Omicron variant, he will be interacting with the chief ministers at 4:30 p.m. today via video conferencing. The Prime Minister chaired a high-level meeting last week to assess the COVID situation in the country, ongoing preparedness of the healthcare system, and the status of the vaccination campaign. With India's COVID positivity rate at 11.05%, the centre said the rise in positivity rate in the last 12 days have been sharp and concerning. On December 30th, the case positivity rate was 1.1%. Niti Aayog member for Health, Dr. V.K. Paul, has said that Omicron was fast replacing Delta and warned that Omicron is not a common cold, that this is a misconception that is spreading among people. Now, if we take a look at the deaths, the rise in deaths in the last 2 weeks in 24 states, it's been an average of 56%, and the states with the most number of cases this week have been Maharashtra, West Bengal, Delhi, Tamil Nadu, Karnataka, and states with the fastest rise in cases have been UP, Bihar, Puducherry, Tripura, and Madhya Pradesh. Director General of the ICMR, Balram Bhargav, has stressed on a 7-day home quarantine for all contacts of any positive case according to the guidelines. He also added that they should continue to wear a mask.
Most important is home quarantine for all contacts for 7 days. So if I have come here for work, I go back home and I test positive, all my relatives who are above 60 or comorbidities should be tested. All my children, etc., should not be tested, but have to be in home quarantine for 7 days. Have to be in home quarantine for 7 days as per guidelines, and continue to wear masks. So use of mask is vitally important when you are doing home quarantine.
Now, Delhi has logged 27,561 fresh COVID cases, which is a 29% rise over cases in the last 24 hours and the most number of cases in a day since April. The positivity rate has touched a whopping 26%, which is the highest in 7 months. On April 20th last year, the city had reported 28,395 cases. The city also reported 40 COVID deaths, which is the most since June 10th. And Maharashtra has reported 46,723 new cases. That's a 36% rise. 32 new deaths have also been reported in the state. The state reported 34,424 cases and 22 deaths the day before. If we talk about Mumbai, then 16,420 new cases have been reported. That's a 40% rise in a day. The positivity rate has gone up to 24.38%, which is up from 18.75% in a single day. Of the 16,420 new cases, 83% of the patients are asymptomatic, is what the BMC has said. But with 92% recovering at home, playing a crucial role are the wardrooms of Mumbai's civic body.
So we have increased our line from 10 lines to 30 lines now. Even the war room doctor staff has been increased. Even the area of the war room has been increased.
The BMC COVID ward war rooms are a critical piece of infrastructure in tackling the third wave of COVID, largely believed to be driven by the Omicron variant. Now, in this wave, most patients are in home isolation, and that means that the ward war rooms are keeping track of their treatment.
तुम्ही कोविडची टेस्ट घेतली का? हो. ओके, का केली होती? काय सिम्पटम्स होते मॅडम तुम्हाला? हातपाय अंग दुखत होतं आणि थोडीशी कसकस होती. तुम्हाला बीपी डायबिटीज काही आहे का? नाही. अस्थमा थायरॉइड आहे? हो. आता तसं काही त्रास नाही होत, म्हणजे नॉर्मल आहे. वॅक्सिन घेतलं मॅडम?
So you can see how every detail of the patient who is in home isolation is being collected here by this lady from the ward war room of the BMC.
ठीक आहे मॅडम, बाकी काही असेल ना तर या नंबरवर कॉल करा. ठीक आहे, हा इमर्जन्सी लँडलाईन नंबर आहे. काही त्रास झाला तर या नंबरवर कॉल करा. ठीक आहे, थँक्यू सो मच.
The patients say they feel assured by the calls.
माझं वय 70 वर्ष आहे. 4 दिवसापूर्वी कोरोना टेस्टमध्ये मी पॉझिटिव्ह आले. शिकडून वारंवार चौकशी केली जाते, फोन करून औषधं दिली जातात. परत आमचा बीपी, ऑक्सिजन लेवल हे सर्व कसं आहे हे सर्व चौकशी केली जाते. म्हणजे आमची काळजी घेतली जाते BMCकडून.
Ankur Gupta, a bank employee, says the ward war room has been following up regularly with him.
BMC has been really proactive in making sure that, you know, I am not left alone in such tough times. I got multiple calls from various people in BMC asking if I needed anything, if I needed any help.
Here's another call that's taking place at the same time. Let's just listen into this conversation as well.
अच्छा, अगर आपके घर में फैसिलिटीज अवेलेबल है तो आपको होम क्वारंटाइन कर देंगे. ओके, ठीक है, चलेगा. थैंक यू सो मच सर.
Last 2 to 3 days we are receiving near about 400 to 500 ka list, but before that 2 to 3 days before we were receiving the list of 1,900 patients.
This is how the ward war rooms in Mumbai are tackling the third wave of COVID. With camera person Rajendra Dhalkar, inside the ward war room of the G North ward, Saurabh Gupta, NDTV.
Well, time for us to slip into a break. On the other side, we focus on Kerala that has seen a 100% rise in daily COVID cases over the last week. Welcome back. Well, the latest COVID numbers have been released by the Health Ministry, and over 2,47,000 cases have been reported in the last 24 hours. The positivity rate is 13.11%. The active caseload currently is 11,17,531. Let's go across to Akshay now for more. So, Akshay, as was expected, now you have the daily cases crossing 2 lakhs, over 2 lakhs being reported there, 2,47,000.
Well, the situation is extremely concerning, Gargi, because this is something that the experts had predicted back then. The R0 is also very high. What we are looking at right now is not just a wave. It again looks like a tsunami like we saw during the second wave in last year. because the active cases at 3.08%, these are almost as high as the cases we were witnessing in April. 2.5 lakh cases clearly show that the number of cases are not just rising in the metropolitan cities now. They have started reaching and increasing in tier 2 cities as well, which does not have a lot of good preparations as far as the healthcare infrastructure is concerned. This is something that the healthcare experts have been saying, that Omicron is not common cold. It will overwhelm the healthcare infrastructure, and this is what we are seeing right now. As far as the health ministry is concerned, they also have made some grim predictions that the number of cases are constantly going up. In cities like Kolkata, the positivity rate is 60%. That is extremely concerning. So it remains to be seen that how exactly we are trying to bring in more curves, because elections are happening in 5 states, and in a state like UP, the doubling rate, the number of active cases that have risen in the past 1 week are 14 times, which is in fact the highest in the country. And despite that, small gatherings are happening while there is a ban on the rallies. So it remains to be seen that whether this ban will be extended, whether more curbs will be brought in to make sure that the number of cases do not increase and overwhelm the healthcare infrastructure, Gandhi.
All right, so worrying numbers there, with over 2,47,000 cases being reported, and everybody, all the experts and administration closely watching the hospital numbers right now. Well, let's move on now to election news, and the BJP will hold its first election committee meeting today. The meeting will be held at the party headquarters and will start at 10 this morning. Let's go across to Sanket for more. And Sanket, the Prime Minister will be attending this meeting.
Yes, so this is usually the flow of the meetings that take place in the Bharatiya Janata Party before they select candidates ahead of every election. So you saw that there were 2 days of brainstorming that was done by the core group of the Bharatiya Janata Party. As of this moment, the BJP only wants to finalize the list of candidates for the first of Uttar Pradesh polls, because they are the ones that are coming, immediately. The Prime Minister is going to attend this meeting of the BJP Central Election Committee. This is the final signing off authority, or the final meeting after which the BJP releases its list of candidates. A couple of interesting decisions that need to be taken. How many seats should go to the alliance partners, given the fact that Akhilesh is quickly fixing his own alliances. So the BJP, we learned that late night had crucial meetings with its own alliance partners so that they are on board and they don't drift away to another political establishment. Number one, that. And number two, who gets what within the BJP, keeping all the permutations and combinations in mind. There was great talk of the Chief Minister himself getting a seat from Ayodhya. Right. This was discussed extensively in the BJP core group meeting. However, a final decision on all these things will be taken only today. This is just the beginning of the Central Election Committee meeting. Many more rounds of such meetings will take place. Prime Minister will be in attendance.
Welcome back. Now, COVID cases are rising across the country, but festivals also taking place ahead of Sankranti festival in Bengaluru. The city is witnessing a massive chock-a-block of vehicular traffic. Residents are on a shopping spree, making the most of the festival season. Commercial hubs such as Chickpet and others and major junctions connecting avenue roads are seeing bustling with people purchasing flowers, fruits and other festive products. The massive rush comes at a time as Bengaluru has recorded a big jump in cases on Wednesday. The Karnataka government has issued fresh guidelines. The guidelines restrict temples from performing special sevas, and only routine pujas will be allowed, and only 50 devotees will be allowed inside the temple premises at a time. And in Assam, as Assam gears up to celebrate Magh Bihu, the state has once again reported a single-day highest spike of cases, 3,274. Positivity rate is 6.56%, and Guwahati alone has reported over 1,100 fresh cases.
One is, in fact, the people with comorbidities. it may produce sickness. And then, it is much higher, the replication level is much higher than the other variant. That is why we must be very concerned and we must be very cautious, because Bihu is ahead. You have told Bihu is ahead. We must be very cautious. We must avoid unnecessary travels. We must avoid the gatherings. Especially, the family gatherings, sometimes you require the family gatherings, but it should be in a very open place.
And the UP Chief Minister has appealed over the massive Prayagraj fair, which begins tomorrow. The Magh Mela begins tomorrow with Makar Sankranti and a dip at the Sangam. And lakhs are expected to take a dip in the morning tomorrow. The Chief Minister has said that appeal to symptomatic, those with single dose of vaccination not to attend. Meanwhile, neighbouring Uttarakhand has banned the Makar Sankranti dip at Haridwar over COVID concerns. But the Magh Mela in UP is going ahead. UP has reported 3,600% jump in fresh COVID cases on Wednesday since Jan 1st. All right, so worry as festivities are going ahead, and India reporting a record number of cases. Over 2,47,000 new COVID cases have been reported in the last 24 hours. That's a 13.11% positivity rate, and the active caseload is currently 11,17,531. Now, this as different directions are coming from the centre over the handling of COVID cases. To talk more about India's situation and the protocols to follow, we're joined by Dr. Jagdish De Hiramati, Chairman, Asra Multi-Speciality Hospital, Bengaluru. We're also joined by Dr. Hemant Deshmukh, Dean of KEM Hospital, and Dr. Vivek Nangia, Principal Director and Head Respiratory Critical Care Medicine, Max Sake. Thank you so much, doctors, for joining us. And Dr. Hiramat, first to you, given the rising cases, it's worrying seeing the festival season and the crowds that are out on the streets.
Yeah, there has been no reduction in the number of cases. There is no respite. The number of cases are going on increasing, and people are going on as if there is no tomorrow. They're not trying to take a relax a bit and go slow. They're not doing that. They're behaving literally as if there is no pandemic or nothing happening around. Of course, it has been aided by the fact that the number of cases, what we are seeing now, we are seeing a huge jump in asymptomatic patients and incidental positive findings of a lot of people who come in for different reasons. Even in our hospital, patients come in for a different reason, and when we check them up, they turn out to be positive. So there is something else which is happening. I feel that it's spreading quite fast, but the number of asymptomatic cases and the incidental findings are much more than what the number is being projected out there. This is
right.
What I feel.
And what would you say about the messaging? Let me take that to Dr. Deshmukh. The kind of messaging coming from the government. Earlier there was something about, not testing. Now they're saying that no, whoever's come in contact must isolate for 7 days. The elderly must be tested, but the youngsters or the children at home need not be tested, but must isolate. So, these kind of directions coming from the government.
Kargi, good morning. What bothers the Indian population is that what causes a spike of Omicron cases right now, and this is effectively to be blamed to the human behavior, that is purely COVID inappropriate behavior of people. You just can't force people to stay indoors. This variant, which is called as Omicron, is highly, extraordinary and unprecedented efficiency that it has. Wants to infect each and every one in the household. If one person in the house gets infected, all others will get infected. There will be nobody in the entire country who may not get infected. But one point of caution here, Dagi, is that this is not common cold. People are realizing that this is just common cold, runny nose, and they tend to go out even after 2 days. The highest infectivity and the transmissibility of Omicron is in the first few days when the RT-PCR or RAT, what we call as the rapid test, is not done. So when you do actually a rat, the infectivity and the transmissibility have already gone down. So what needs to be done is you do as many rat as possible, as many rapid antigen tests as possible, and isolate yourself. This is the only way to win over the Omicron transmissibility. And human behavior cannot be either turned, or you cannot mend their ways. And the winter months are obviously, fueling this spike in the number of Omicron cases.
That's right. In fact, the centre has said that this is a misconception that's spreading, that, it's just like a common cold, but it's not. It is more serious. Dr. Nange, if you could share with us, what has the experience been so far in terms of the hospitalizations? What are some of the worst symptoms that you're seeing?
Good morning, Gargi, and thank you for asking me this question. I think we are following exactly what is happening in the West also. South Africa had a very sudden spike in the number of cases, and then it started to come down also as suddenly. So we are hoping that we also follow the same trend. While in the US, UK, the numbers are still on the rise. UK has reported some 2 lakh plus cases, which is the highest ever in the entire pandemic. And US has actually broken all records and has reported some 10 lakh cases. So
that's right.
We are also following the same trend. And as far as hospitalization is concerned, the hospitalization rates are also going up slowly and gradually. Not as much as they were in the Delta variant, I would still admit that. But yes, we are heading towards it. And if we don't control our behavior now and cut this cycle of the spread of the virus, then we may land up in a situation where the hospitals are getting overwhelmed. As it is, healthcare workers are getting affected. We are short of staff at times, but we're still managing it somehow. So I think all these things need to be taken into consideration.
No, absolutely. I mean, it's just burning through the population in a sense, this Omicron variant. Dr. Hiramat, if you could, also share with us what you've been seeing in the hospital in terms of, the patients coming in. Also, this time around, and this has been spoken about, we're not seeing that demand for oxygen or oxygen monitoring the way we saw it in the second wave.
Yes, I agree with you. In the initial days, like about a week or so ago, we were not seeing patients requiring oxygen or requiring ICU. But in the last 2-3 days, there is a small trend up. I think this is related to the increasing number of cases. And although the percentage of patients who require oxygen and who require ICU care is much lesser compared to what we saw in the second wave, the requirement is still there. We still have patients who have concomitant other disorders, who come up with falling short of their own requirements and needing support. So these are the patients who will require, whom we commonly call as comorbidity, people with comorbidities. So these are the people who are ending up becoming, requiring ICU care and oxygen support. I'm not seeing, as of now, we are not seeing any young patient requiring oxygen like what we saw in the second wave. But we are seeing quite a few number of patients who require oxygen and who require ICU care also. In my own hospital, we have about 4 patients who are requiring NIV.
Right.
So there is a requirement. I think if the numbers keep increasing the way it's gone up in US, if we start touching, let's say 1 million, 2 million, the way it's happening in US, I feel the system is going to be overburdened.
Right, and it's worrying seeing, these crowding and festivities taking place. The Magh Mela tomorrow, you're going to have, lakhs of people taking a dip. Dr. Deshmukh, now we know in Mumbai and other states as well, but Mumbai especially, you have war rooms, you're managing people under home isolation. But the fear also with Omicron is, what do we know so far about it? Because, earlier we've spoken about long COVID. Now with Omicron too, the dangers are, even if your illness is mild, you could see symptoms carrying on till later. Also, the infectivity post Omicron infection. Do we know anything about reinfections post Omicron infection?
Exactly, Gargi. What I was always wanting to tell you, that Omicron is not a very benign disease. This is not common cold or common fever that you people have been experiencing for so many years back. But the long COVID, that is the after effects of Omicron infection, may be devastating. We really do not know what will happen. There are diseases like stroke, transient ischemic attacks, heart attacks. There are probably transverse myelitis and possibly all kinds of diseases which probably we have seen in the second wave following the COVID. Now this long COVID, last year we saw a lot of increase in the number of diabetics also, newly found diabetics or newly diagnosed diabetics. Luckily for us, COVID this time, the Omicron is not causing any kind of lung disease or lung parenchymal disease. So that is one point which is very soothing, at least for the asthmatics and those who already have a background lung parenchymal disease. But the after effects of Omicron, really nobody understands. But you should understand that this is likely to cause a high thrombotic index of the blood, and which may eventually cause either gangrene, cardiovascular thrombotic effects, or anything which cannot be predicted at this time. Second wave, we did not predict mucormycosis. This time we don't know whether mucormycosis is going to resurface again.
Right, and those are the dangers. Dr. Nange, anything that you'd like to add to this?
So basically, we still don't know how this will pan out in the times to come. You know, whether long COVID syndrome will happen or will not happen. This is a virus which is very, very unpredictable. And what is also important is that if this continues to soar as high as it is and persist in the ecology, then definitely it is going to further undergo mutation and a new variant may just come up. We have already heard of one variant in France. There's another one which is being worked upon so far. So you never know.
Yes.
We may just, end up having a newer variant within the next 6 months. So we have to break this cycle. That is what I'm trying to say, that we have to curtail our movement outdoors. We have to restrict our gatherings. We have to follow all the COVID appropriate behavior. And more important than that is to get themselves vaccinated. You know, all those people who still haven't received their first vaccination, they go in for the first and the double vaccination. They have to go in for their second vaccination. So there's huge potential of dangers that will be coming in times to come.
Absolutely, and potential dangers is what we all need to be aware about and not treat this, casually, the manner that we're seeing people crowding around. Thank you so much, doctors, for sparing your time and joining us on the program this morning.
Thank you, Gargi.
Thank you. Welcome back. News from Jammu and Kashmir, where a policeman and a Pakistani terrorist have been killed during an encounter in the Kulgam district. 3 army soldiers and 2 civilians have also been injured during the gun battle which started yesterday evening. Let's go across to Nazir for more. Nazir, what is the latest? And the target house where these terrorists were hiding has been destroyed?
Exactly. And operation is over. And police say the militant who has been killed has been identified as Babar Bai, a Pakistani militant who was operating in the area since 2018. 1 police constable has lost his life, 3 army soldiers have been injured, and 2 civilians have also been injured have been shifted to the hospital where they are being treated. But what is the worst thing for the people there who live? Their houses are getting destroyed. One target house where militant was hiding has been completely destroyed, and there has been damage to the other residential houses as well. So it happens almost in every encounter. Whenever there are encounters, it's the people, common people who lose their homes and their houses are getting destroyed almost in every encounter wherever militants are hiding. So this is operation which was 8 encounters in last 12 days, in which 14 militants have been killed. And now see, in this encounter, 1 policeman has lost his life and 3 soldiers have been injured.